An issue in early childhood education is a lack of mental health support and social emotional learning, SEL, that is implemented into classrooms. There is currently a huge mental health crisis, so I believe that by focusing more on mental health and SEL while children are young can improve their chances at a healthy and stable life. The key stakeholders in supporting mental health and social emotional learning in early childhood include the children themselves, their families, and early childhood educators. School administrators, mental health professionals, and policymakers also play important roles in shaping programs and allocating resources. To combat this issue, SEL needs to be integrated into the curriculum. Children need to be educated on emotions, how to identify them, how to manage them, and what roles they play in everyday life. This can be done by emotion check-ins, problem-solving activities, and morning meetings. It is also important that all children have access to mental health support, which can be done by all schools requiring mental health professionals. It is also important to emphasize early intervention, which begins with ensuring that teachers are well educated and trained. Early access helps children manage stress, trauma, and anxiety before they develop into larger behavioral or academic challenges. Research shows that implementing SEL leads to better outcomes for children both academically and emotionally. In a meta-analysis published by JAMA, researchers were able to conclude that social and emotional learning programs may be an effective way to increase emotional competence, behavioral self-regulation, early learning outcomes, and also reduce behavioral and emotional difficulties in children. There is also evidence from a 2024 study in Japan that implemented an SEL program with young children and found that the children's behavior problems and anxiety were significantly reduced after the intervention. This supports the idea that SEL not only improves emotional competence, but can also reduce mental health problems when acted on early. An agency that would support my cause is the U.S. Department of Education, as they oversee education and fund early learning programs. The Administration for Children and Families would be likely to support this cause as well, as they provide comprehensive early childhood programs for low-income families and include strong components of social emotional development and mental health support.